Hi, I'm going to do this again where I talk about what I learned today from my preceptor because he asked me something and then I didn't know the answer. So then we pulled up a paper and literally read through the paper on the spot and started answering questions about it. So it started because when he was having me draw and administer drugs to the patient, I noticed that we weren't going to use one of the antiemetic or the medications that help with nausea and vomiting, but we were using the other one. So I asked him why we weren't using metoclopramide, which is a dopamine antagonist, which means it decreases your dopamine response. And he said that it was because the patient was elderly and we don't want to use that in elderly patients. So then that led him to ask me, do you know about post-operative nausea and vomiting, like the risk factors and the risk effects? And I wasn't sure what he was saying and I wasn't sure what he was asking. So then he goes, you obviously don't. So then let's look up a paper about it. So he told me to look it up once things settled down in the OR. So I looked it up and I was reading on it. And then he let me read about it and then asked me to tell him what I read about. So what I was telling him was, okay, so the risk factors for getting post-operative nausea, there's an increased association with getting post-operative nausea for patients who are young to middle-aged, patients who are female, patients who are non-smokers, which is not an encouragement to smoke. It's just the fact that for some reason non-smokers are more prone to getting nausea than smokers are. And then it depends on the agent that was used to keep them anesthetized, and it also depends on the type of procedure. So procedures that involve your head, your ears, your eyes, you're more likely to get nausea from, or gynecologic procedures or obstetric procedures, you're more likely to get nausea and vomiting from. And there's an acronym PONV, post-operative nausea and vomiting. And then he asked me, okay, so then what are the treatments for post-operative nausea and vomiting, and how do you know when to use them? So based on how many risk factors a person has, so if they are young, female, and they don't smoke, that's 3 risk factors. Some institutions will use the number of risk factors that the person has and then directly correlate that to how many medications they should be given. So in this case, if they have 3 risk factors, they should be given 3 medications. Well, what are the medications that we give them? So then we looked at it and it said that you give them all antagonists, a dopamine antagonist, a serotonin antagonist, a histamine antagonist or an antihistamine, and then a cholinergic antagonist or an acetylcholine antagonist.